be fought. So working people, use your power to keep your liberty. Don't support that rich man style of luxury. And there ain't no way they can ever keep us down. Oh no, ain't no way they can ever keep us down. We won't be bought, we won't be sold, to be treated right. Well, that's our goal. And there ain't no way they can ever keep us down. Well, we've been shot and we've been jailed. Lord, it's a sin. Women and little children stood right by the men. But we got that union contract that keeps the workers free. And they'll never shoot that union out of me. And they'll never shoot that union out of me. Oh no, never shoot that union out of me. Got a contract in our hands, signed by the blood of honest men. And they'll never shoot that union out of me.
What? SODEPY.
Well, the power wheel is rolling, rolling right along, and the government helps keep it going strong. So working people, get your help from your own kind. Your welfare ain't on the rich man's mind. Your welfare ain't on the rich man's mind. Oh no, your welfare ain't on the rich man's mind. They want the power in their hand just to keep down the worker, and your welfare ain't on the rich man's mind. They'll never, never, never keep us down. Oh no, never, never, never keep us down. They'll cheat, rob, frame, or kill, but we'll stop that big wheel. And they'll never, never, never keep us down. They'll never, never, never keep us down.
Welcome, everyone. Bienvenidos. Thank you for joining us today. Gracias por estar con nosotros. I hope you enjoyed that wonderful music by Jonathan and Annie Rosen. Espero que pudieron disfrutar esa música por los activistas Jonathan y Annie Rosen. My name is Jessica Martinez, and I serve as the co-director for National COSH, working with a wonderful team who you may see and hear today. Mi nombre es Jessica Martínez y sirvo como la codirectora de COSH Nacional y trabajo con un gran equipo que van a conocer ahora igualmente. So thank you for being with us today. I'm going to ask folks if you can mute yourselves, because we're going to have a really powerful program today. Les voy a pedir a todos que por favor se silencien si tienen mucho sonido atrás. Vamos a tener un programa muy poderoso ahora. So we're going to get started now. First, we're going to have English and Spanish. If you don't speak both English and Spanish, don't worry, we got you. In a moment, you will see a globe at the bottom of your screen and an announcement saying interpretation is available. When that pops up, choose English. If you are in your smartphone with the Zoom app, you may have to go into the 3 dots icon to find the globe or the words language interpretation. Antes de comenzar, queremos que las personas sepan que participaremos en inglés y español. Si no hablas inglés y español, no se preocupe. En un momento verá un globo en la parte inferior de su pantalla y un anuncio que dice que hay interpretación disponible. Cuando le aparezca, elija español. Si está en su teléfono con la aplicación de Zoom, es posible que deba ingresar al icono de 3 puntos para encontrar el globo a las palabras language interpretation. If you have any issues, don't suffer in silence. Please write it in the chat to Jessie Cruz. And if you can't find the chat, let us know with your voice. Si tiene algún problema, no sufra en
If
silencio.
you have a problem, don't suffer in silence. Please write to Jessie Cruz, who you'll find in the list of participants in the chat. And if you can't find that Jessie Cruz in the chat, let us know with your voice.
Make sure that our interpretation is working. Está activado ya la interpretación, because I will be
To
going
make sure interpretation is working.
in mode myself. So can I get a thumbs up from Jessie if we're working? That's who I can view. Perfecto. Thank you, everyone. So we're going to be breaking into smaller groups later in the program today, so we can do more thinking about the way that we're connecting. And since we have monolingual participants, we need everyone's help. We need you to go to the bottom of your screen, click on participants icon, and click more or the three dots icon. So I'm just gonna ask folks to mute yourself there. So going back, and if you prefer to join in English, an English speaking group, use the @ as the first character and then add your name, pronoun, and organization if you would like. If you prefer to join in Spanish speaking group later today, use the numerical sign or hashtag as the first letter and then add your name, your pronoun, and organization if you would like. Only if you have no preference between English and Spanish, use as the first letter, then your name. You can just use your first letter and then your name, and we will randomly assign you to a group. Also, as a heads up, I know we have a couple reporters and journalists on the call. So if you're a reporter, if you could add a capital R, your name, that will help us for later during the Q&A for the press later in this program. So let me take a couple minutes just to review our agenda for today. We'll begin with the reading the names of workers who have died or been injured on the job. Then I'll take a minute to share our reaction to the big news coming out of OSHA yesterday about the new COVID-19 emergency temporary standard. Next, I'll introduce our speakers from across the country. We have folks from Kansas City, Nashville, Georgia, New Bedford, Massachusetts. Each of them has a very important story to tell. Following the testimonies, I'll share a brief highlights from our report, Deadly Risks, Costly Failures. And after that, we'll break into smaller groups. All our speakers and journalists who have joined the call will remain in this main room for Q&A. The many other health and safety activists who are with us today will go into small groups to connect with each other and envision what we're doing after Workers' Memorial Week to protect workers' lives in our communities. And after the small groups, will come together for a virtual action. So we really encourage you to stay for this full program. It'll be a great interaction, both an opportunity to share in some of the local work. During the action itself, we'll be using some homemade posters to honor workers we have lost. Have a marker and a piece of paper ready for this part, and please take a look at the chat to see how you can participate. So now we're going to begin with the reading of names. We're going to begin with the power of our voices, just a small sample of the many workers we have lost this year. Let me introduce to you the members of our network who will be representing all of us during this portion of the program. We have Angela Castillo Vilches from COSH. We have Blanca Delgado from Border Workers United. We have Joe Tatch from Massachusetts COSH, Eddie Sanchez from Southern California COSH, and Maggie Longmire from our Knoxville COSH. So Angela, whenever you're ready.
Miguel Garcia, 50 day labor. Jan Michael, 47, teacher. Faye Jackson, 75, nursing aide. Celia Marcos, 61, registered nurse. Rosa Luna, 67, hospital janitor. Jess Lucero, 66, school janitor. Adonis Ramos Soriano, 24, construction worker. Alfredo Pavatao, 68, medical transporter. Susanna Pavatao, 64, healthcare aide. Gustavo Quique Ramirez, 16, construction worker.
Gerardo Gutierrez, 70, grocery worker. Saulo Suarez Bernal, 41, poultry worker. Corey Allen Murphy, 35, poultry worker. Jose de Jesus Elias Cabrera, 45, poultry worker. Edgar Uriel Vera Garcia, 28, poultry worker. Victor Les, 38, poultry worker. Sehdi Kah Bulik, 58, meat processing worker. Edwin Pat Mason, 57, logger. Michelle Villarreal, 43, school cafeteria manager.
Pamela Hughes, 50, nursing assistant. Francisco Chingo Gomez, 55, seafood processing worker. William Billy Kuto, 63, seafood processing worker. Leilani Jordan, 27, supermarket greeter. Celia Yap Benago, 69, registered nurse. Dulce Garcia, 28, interpreter. Julie Davis, 40, teacher. Lynn Jones, 52, deputy sheriff.
Jose Atunes Garcia, 68, farm worker. Adolfo Fernandez, 51, porter. Carrie Lyman, 45, respiratory therapist. Michael Paczynski, 54, roofer. Paul Friscorn, 65, flight attendant. Simeon Romero de Leon, 46, tree service worker. Wendell Smith, 75, transportation worker. Londell Woodbury, 23, corrections officer.
Doug Bledsoe, 69, coal ash cleanup worker. Joe Percival, 61, coal ash cleanup worker. Ernest Hickman, 55, coal ash cleanup worker. Jean Nance, 61, safety office staff at coal ash cleanup. Adeline Fagan, 28, doctor. Trish Berry, 54, financial aid specialist. Donald Downs, 60, firefighter. Garrison Merrill, 24, farm equipment mechanic.
Thank you so much, Angela, Blanca, Eddie, Joe, and Maggie, for reading those names. And again, just to remind everyone that that was only a small sample of the many workers who have died in the workplace from preventable deaths. It's so moving for me to hear the names and see the faces of workers who have suffered these deaths. It reminds us all of why we are here today, to honor the dead and fight for the living. I'm hopeful that our fight for the living took a step forward last night when OSHA announced the first step towards issuing a new COVID-19 emergency temporary standard, or ETS for short. National COSH and our allies in the health and safety movement and the labor movement have been advocating for a standard to protect workers from COVID for more than a year now. And today we're finally on a path to get it done. OSHA has sent this new rule to the Office of Management and Budget for review. But let's be clear, this review must be swift, it must be certain, and we must get this regulation in the field where it will save worker lives. With this kind of regulation in place, combined with a strong, effective enforcement, I hope we have fewer names to read aloud next year during Workers' Memorial Week. The life-saving benefits of an ETS are enormous because it will require every employer to have COVID prevention plan with full input from workers, those in the front lines. The cost will be reasonable and the science is sound, so let's get it done. Now, we all know that the fight for the living isn't just about what happens inside government agencies in Washington, D.C. It's about what happens every day in all our workplaces. That's why I'm very proud to introduce our powerful speakers today. Each will share their very personal experiences about what has happened to their coworkers and loved ones, and about what we can do collectively to prevent future tragedies. First up is Pascaline Mahundra, a member of the National Nurses United. She will tell us about her coworker, Celia Yapanago, a nurse who died from COVID after caring for a sick patient. Pascaline?
Yes, thank you so much. Hi, everyone. My name is Pascaline Mahundra. I'm a critical care nurse at Research Medical Center, an HCA healthcare facility in Kansas City, Missouri. I'm a proud union member of National Nurses United. I'm here today to remember my colleague, Celia Yapanago, and all the nurses and frontline workers who have lost their lives because our employers did not give us the protections we need during the COVID pandemic. In January 2020, nurses urged our employer to prepare for COVID. They didn't. When the pandemic started in March, none of the COVID nurses had been fit tested for N95s. Management had not implemented our recommendations from January. On March 21st, management collected all the PPE in the hospital, locked it up, and began rationing N95s. The next day, a patient was transferred from the emergency department to the cardiac telemetry unit. The nurses on the unit recognized the patient had signs of COVID, and they asked management for N95s. Management refused. The patient later tested positive, and as a result of her exposure to this patient, my colleague Celia Yapanago contracted COVID and lost her life. Celia was scheduled to celebrate 40 years of service for Kansas City patients the week after she died. Despite Celia's death, the hospital continues to ration N95s. Management is still forcing us to unsafely reuse the same N95 for an entire shift and is recommending that we use surgical masks with COVID patients. This isn't just happening in my hospital. In NNU's February 2021 survey of nurses across the country, more than 81% report that they still have to reuse at least one type of single-use PPE. As union nurses, my colleagues and I have been fighting these dangerous policies every step of the way. As registered nurses, we know that as long as our safety is compromised, our patients are also at risk. My union filed a complaint with OSHA last spring about the circumstances that led to Celia's death. OSHA found clear evidence that Celia and other nurses had been exposed to COVID because of our employer's failure to provide PPE. But OSHA could not cite my employer because the CDC guidelines are weak and because OSHA doesn't have a standard on infectious diseases. As union nurses, with our practice rooted in science, we know that we need to be able to care for our patients safely. We need the CDC to update its COVID guidelines to fully recognize aerosol transmission. We need the CDC to revoke the crisis standard on optimization of PPE. These are the guidelines that allow employers to continue to ration our access to life-saving N95s. We need a federal OSHA emergency temporary standard that requires our employers to protect our health and safety at work. We enthusiastically welcome the news that President Biden's administration has taken the next step in issuing ETS, and we urge them to complete their review quickly. It's not too late to protect nurses and frontline workers. We will keep fighting until we win. Thank you.
Thank you, Pascaline, for your strength and for your commitment to keep this fight and moving forward. Thank you for that moving testimony about your wonderful friend, Celia, and for reminding us why we need an ETS, an emergency temporary standard from OSHA that can make a difference and save worker lives. Now I'd like to introduce Jennifer Enamorado Ayala with Workers' Dignity. Her brother, Gustavo Quique Ramirez, died at just the age of 16 from a preventable fall on a construction in Nashville. Jennifer, are you with us?
Yes, I am.
Thank you.
I want to thank everyone for your presence today, and thank you, COSH, for inviting me to speak. As Jessica said, my name is Jennifer Enamorado Ayala. My brother is Gustavo Ramirez. We affectionately call him Quique. And he was 16 when he fell 120 feet, which is the equivalent to 11 stories, from the roof of a building down to the ground floor. He fell due to the negligence of his employers, that one did not provide a harness and told him and the other workers there that a harness was not required for them to do their job. He was illegally certified to operate machinery on the job site, and he was provided a job that he was also legally not able to do. My family is blessed to be citizens of the United States and to be able to speak out to these injustices. Unfortunately, not everyone in the construction business is able to do so due to their legal status. My brother, when he fell, no one at the job site called 911. My 18-year-old brother was with him. He was the first one to get to him to try to provide aid, and the only individual on the job site that called 911. Being here today, even if it is an honor, is not easy. I would rather not. But our presence, my presence, is necessary to try to make sure that no other family has to endure this type of tragedy, to lose someone in a preventable accident at work, to find out that management did not try to render aid or call aid to help save the life of my brother, for people to assume his age and legal status due to not finding an ID on him, even though he just turned 16, so he didn't have his driver's license. Work shouldn't kill, and we need stronger requirements for companies in the construction industry in Nashville and around the country to assume responsibility for their contractors and subcontractors to ensure the safety of their workers, because these workers build our cities, our nations, our economies. Thank you.
Thank you, Jennifer. Thank you for your bravery, and thank you for joining us. I am so sorry that you and your family have to go through this. Thank you for doing everything you do to fight for stronger safety rules so that more families will not experience the tragedy that you have gone through. Again, I at a loss for words and cannot imagine the pain of your family, but we are thankful for you to have the strength to join us today. I want to now move on to our next speaker, we have a video from Hugo Flores from Georgia Familias Unidas. Hugo survived a preventable nitrogen leak at a poultry plant in Georgia that killed 6 workers. This is a story about an employer that treats a mostly immigrant workforce as expendable, an employer that did not follow safety protocols, resulting in a terrible tragedy, an employer that in the aftermath tried to silence workers, but Hugo will not be silenced. So I'd like everyone to please tune into this video. I also want to give a heads up that the audio is a little low, so please pay attention and try to keep your volume high so you can hear the full video. Thank you.
Fue el último que salí de los que trabajamos acá en el lado del frente.
I was the last of those who work here across the street. They prohibited us from talking to anyone, from answering any questions. If anyone came to ask questions, the accident happened, 6 people passed away. And what I heard was that they had found one of them with their head frozen. They had fallen on the floor. I found out that they had knowledge of the leak 2 weeks before, but for some reason, they didn't do anything to fix it. On Tuesday of that week, supposedly a technician came to seal the leak. And I also heard about a mechanic that there had also been an accident with nitrogen. He had his fingers bandaged, and there was a missing piece of his finger. They continued working. They didn't want to stop. They sent mechanics to seal the leak without closing the nitrogen valve, and that's what happened. They should treat people in a more humane and more dignified way. They trample on the dignity of people completely, without pity. Only someone really messed up could do that, could treat someone in that way. They take advantage of people's situation, and it's obvious. It's completely evident that they trample on people's dignity. They exploit them, and they do whatever they want with people. So what I want is for that to change, but unless the government makes them change it, they won't change. Because on their own, I doubt they will change on their own.
So that was Hugo, and I apologize for the audio. I know it wasn't the best quality, but essentially telling a story of the insistence of workers having to work despite the horrendous situation at work, with no safety protections, no consideration for the life of workers. We also have, I'm very glad that we have Maria del Rosario Palacios, who serves as the executive director for Georgia Familias Unidas, who has been doing incredible work to organize local workers, and is on the call today and can answer more questions about this tragedy when we get to the Q&A session. But for now, let me introduce Adrián Ventura, who serves as the executive director of the Centro Comunitario de Trabajadores. He has a different perspective today of what happens when workers join together to protect each other. He's going to tell us about the Pescando Justicia campaign to win safety protections for seafood workers in New Bedford. Adrián, you there? ¿Está ahí?
Sí.
Adelante.
Yes.
Bueno, como lo decimos.
Good. Like we said, here in Bedford, the Community Education Center was created to educate and take actions. When we talk about actions, There's direct action and legal action. So in this case, we were looking for 2012, 2013, 2014. We were created when Victor was killed. Sea-Watch International. This happened in Bedford. 2 workers were killed. In 2014, another person died. So this company does not provide the workers training in health and safety. They don't give protective tools for the workers. So that's when we started to create a campaign that's called Fishing for Justice. And we started with a training, an intense training, in which the workers were the leaders, and they were called to see what change they wanted to have. And at the end, last year, in March, we had a video about COVID-19, which was already public. And we put a video on Facebook Live in which we demanded the workers so that they could talk to their supervisors verbally. So what we did, apart from this, was we got together on April 13th. We got together here in CCT and we created a letter that we call behavior code, so that there was 12 leaders, and we made a letter to give this information to the 31 companies, including there are about 21, and the 21 fishing companies, and the other ones were recycling and other companies, popsicles, other companies. So those are the ones that we sent this letter to. Apart from that, we were concerned because the health system was not doing anything. So the health department in New Bedford was not doing anything. So we had to send them a letter saying that we want to hear what is happening. So they were getting involved with us. And there's a company called Blue Harbor that didn't pay attention at all to our letter. They just it's just until someone dies, then they can close the company. So we had to take legal action saying that we're going to do something. So that's when they got involved with us, with the health department and others who work in the health system. They were closed the company for 72 hours. They cleaned everything up because there were 6 or 12 people who were infected. And that's when we went to other industries that have more than 100 workers, like Eastern Fish. We had to demand that they use the social distancing. Empire was the most corrupt one. We had to demand that they take measures to prevent more deaths or more people getting infected. They didn't give people masks or any protection. They had a lot of agencies come to us and say, okay, we're going to help you guys. They were providing 1 mask per week. Imagine just 1 mask per week. So we had to call the team and the health department again to get the protection like masks. And there were already people that were dying. From our community, there are 12 workers who passed away, including Francisco, which we saw. So those workers suffered because the company exposed him and they didn't take the necessary measures. And we had made demands through letters. And there was no prevention. So we had to work with another team, including our allies like COSH and CCT. So there's a lot of allies. So we had to create some legal councils, and that's how we interacted with the media and with other workers. That was how we understood that if we organize ourselves and we work on a team, both as workers, CCT, COSH, and other groups, that's how we can have a change and we can avoid more deaths. That's how, thanks to those who supported us, we were able to avoid several deaths, but or else it would have continued because some relatives of ours died, other people put themselves at risk. So the company began to take these measures, preventative measures. So now we're working. You saw the newspaper, the front page of the newspaper, that we're working with, not just with COVID, but we're also concerned about the machines that the industries use. Last Monday, we took a letter that included COSH and Justice. We left it with the company because a lot of our colleagues are getting sick from a chemical, from a smoke that this company is using. So that's how we're working. We're also working about wage theft and other things so that we can save hundreds of deaths, because there's about 5,000 people who are working in this industry here in Bedford. And we know that the industry, the Bedford port, is the second port that puts food on the table of a lot of people, millions of people. And they're also being excluded in the vaccine. They're putting us in the third place. They're vaccinating the police and nurses. And I don't want to say that they're not worth it. They are worth it. But we're also putting food on the table of all the people in the United States. And this port is sending fish to different parts of the world. But they're leaving us in the back. And we're getting organized again to be able to talk about this publicly. We had to say, something against the governor. Adriana, if you could finish your comments, please. So through that, we could get them to change the policy. Now they put us in the vaccine. I can't say that with that we're saved, but we continue fighting. It is very important, though, to talk about this. And I'll say again, this project of Fishing for Justice, there's a lot of people who are calling us so that we can use this model in other cities. Thank you very much. And good luck with what we're doing.
Thank you so much, Adrian, for that inspiring story. I know that Adrian is a very passionate organizer and leader in his community. And thank you for sharing that story. I know there is more work to do. And Pescando Justicia campaign just shows that workers can accomplish what they can accomplish when we organize. It's not an easy process moving forward. Thank you, Adrian, for also sharing that the impact to is specifically when it regards infectious disease does not get contained in the workplace. Many of our workers, co-workers are seeing the rippling effects to our own families and communities, in particular in the midst of this pandemic. So moving forward with more protections is crucial to moving our movement forward and to getting this ETS passed. I want to thank all our speakers today for being here with us, for speaking out for refusing to be silenced. That's how we win the fight for the living, with solidarity and, most importantly, with collective action. Before we move into small groups and a Q&A with our speakers, let me say a few words about the report we are releasing today. The title of our report is Deadly Risks, Costly Failures. This year, after all we've been through, we decided to focus on workers and families. As we dug into the facts and figures about workplace safety in 2021, we were surprised to learn just how much we don't know about how COVID-19 has impacted workers. There is no public agency that's tracking overall COVID infections in the workplace. There's no public agency who's tracking the number of workers who have died from workplace exposure to COVID. So even after all that frontline workers have done to keep the rest of us alive, we don't know how many have died from this pandemic. However, here is what we do know. Just in Ontario, researchers estimate that 20% of infections among working age adults can be attributed to workplace transmission. In California, researchers found significant excess mortality among frontline workers due to COVID-19. A 39% increase in mortality among food and agricultural workers, a 23% increase among manufacturing workers, and a 19% increase among health and emergency workers. These are the workers who are getting sick and dying so the rest of us can stay safe. COVID has exposed significant racial disparities in healthcare, employment, housing, and many other sectors. Black, Latinx, and Native people are more likely to get infected, more likely to die from this disease, and are overrepresented in the frontline occupations where workers are most at risk. To be clear, all communities are affected by this pandemic. More than 300,000 white people in the US have died from COVID. Among these deaths where demographic information is available. This disease may not affect everyone equally, but it does affect everyone. While many employers and at times even our own government have failed in the response to the pandemic, workers cannot wait. During the past year, we've seen a wave of more than 1,000 strikes and job actions, many because of safety issues. We've also seen grocery workers in Western New York, seafood workers in New Bedford, as Adrian shared today, and many others fight for and win new workplace protections. We've seen workers, unions, worker centers, and COSH groups fight for and win new city and state protection in places such as Philadelphia, Los Angeles, Virginia, California, Oregon, and Michigan. And now the federal government has taken a major step forward. As I said earlier, I'm hopeful that the starting process for a COVID-19 emergency temporary standard will make a huge difference for workers. However, this process is just starting. Now we have to make sure it's finished. OSHA's announcement yesterday is a huge victory for our movement. We have been fighting for an ETS for more than a year since the very beginning of the pandemic. Now there have been occasions in the past when the final review of an important safety regulation gets delayed. We've seen that with silica. It took 2.5 years held in the OMB, and sometimes they're held indefinitely. So we can't let that happen with this regulation, not this one, not this time. There's too many lives at stake. We're going to stay on the case, cement this victory, and make sure that life-saving rule becomes finalized and published in the Federal Register as soon as possible. So thank you for listening. With that, we're going to break now into small groups. Our speakers and journalists will stay in this main room for Q&A. I'm going to now invite my compañera coworker Marianela, who's going to give us some guidance on how it's all going to work. Marianela?
Hi, people. How are y'all doing? I just want to send you off to the small groups. So as Jessica said, all of our speakers today are going to stay in this main room with the interpretation, and we want all reporters to stay here too. So if we mistakenly send you to a small group and you're a reporter, you do not have to accept that. Just come back to the main room so you can ask questions to the speakers. Now, for all the other amazing activists, family members, COSHers, union folks that are here with us today, other folks from worker centers, we want you to get to know each other. We want you to process a little bit of what happened. And specifically, we have one question for you, which is, what does this today inspire you to do to continue fighting for workplace health and safety after the Worker Memorial Day events for 2021? And so we're gonna have about 10 minutes for that. You should be in groups with either English speakers or Spanish speakers, according to whatever little character you have at the beginning of your name. And I know some folks didn't rename themselves, so you may get to a small group where they don't speak your preferred language, and you can come back to the main room, chat with me, and we'll send you to that room, okay? So we have 10 minutes. You're gonna meet maybe about 3 or 4 other people from other activists, other family members. And we want you to introduce yourself, and we want you to think about what inspires you to be here, or what does today inspire you to do for after Worker Memorial Days to continue the fight for workplace health and safety. And reporters and speakers stay here with us in the main room, okay?
Hello, everyone. So I'm going to send the breakout rooms right now. And please, for those that haven't stayed their language, go with me a little bit so I can send you to the right one. Lina, do you speak English or Spanish? Lina, ¿hablas español o inglés?
Jesse, and if you want, this is completely not ideal, but you can send them off to the group so we can start with the speakers and the reporters here. And then I told them to come back here and ask us for help if that doesn't fly. And I only have one more person that said English, which is Jessica, and I'm about to add the little at to her name. So you should have it now. And I know that Roger, I know the speakers are here. I'm going to start spotlighting them while Jesse finishes up the small groups. I know that Roger is facilitating or moderating this part with the reporters. So I will spotlight you too, okay?
Thanks, everybody. Let's just take another minute or so. But well, I think actually we've got the right number of folks here. So if any journalists on the call have questions, just fire away. Any of our panelists can answer them. If you want to talk about the ETF or any of the presentations you heard. So unmute yourself and go ahead. If you prefer to drop a line in the chat, I can pass the question along. So the floor is open for any of our reporter colleagues who've been able to join us, who have a question for any of our speakers. Go ahead.
Yeah, Roger, this is Mark Gruenberg from Press Associates Union News. And I've got a question for Adrian, which is in so many words. I used to cover for New Bedford briefly. New Bedford has a large Portuguese speaking community. How did you communicate with them? Did he get the question?
Adrian, go ahead.
Yeah, so what happened, because a lot has changed. There's been a big change, not just in terms of the immigrant atmosphere. Now the new immigrants are the Portuguese speakers. They work in textile factories and other places. Now the new immigrants are Central American immigrants. And so because of Hurricane Maria, Puerto Rican immigrants have also come to New Bedford. And so what we are working on and working on educating now are Hispanics and Mayans.
Huh. Okay.
Thanks, Adrian. I have a question from Joe Maniscalco dropped in the chat. I think this is probably for Jessica. And since we know that the airborne nature of COVID, are we confident in the upcoming new standards? Are they enough to guard against future airborne viruses? And what is the strategy to keep agitating for the implementation of enforceable workplace safety standards?
Well, thank you for the question, Joe. We have not, as we know, the standard itself has not gone public. We're hopeful that it's comprehensive enough that provides sufficient protections. At the very minimum, we're aware that the standard itself mandates that employers must have a prevention program in place that allows for workers to provide some input. We know that COVID itself has an airborne, it's airborne, and we need that sort of protections in terms of social distancing, air quality, better protections that are not just limited to personal protective equipment. In this case, mask will not suffice, and training. Now, in terms of our pushing forward is that we have a large network, as you all know, that's national. We have local COSH groups that are doing work on the ground, working alongside workers to make them knowledgeable of their rights through OSHA, in addition to other labor rights, of how workers can make these requests to employers for better protections. And now, hopefully with this ETS, crossing our fingers, moving forward through OMB, can use that also as a way to work with employers and ensure that there's more protection and programs in place. And that's something that we're doing, and alongside ensuring that there's a strong enforcement piece to these standards. As we know that, any standard, any law without the enforcement piece has no real teeth to it. So our COSH groups locally are making sure that that's happening through mobilizing workers and educating the working community.
Thanks, Jessica. Emily Kopp from Roll Call has a question.
Hi, thanks for taking my question. I guess I'm curious, is there a risk that the rules could be delayed so long that vaccine coverage will be such that these rules won't be particularly meaningful? And I'm also wondering if anyone's willing to speculate on what the delay is.
Well, the question about the delay, yes, there is a possibility of a delay. We saw it with the silica standard that was delayed in the OMB for 2.5 years. We are optimistic given the new leadership at the administration. We know that there's highly qualified leaders in OSHA. We're hoping that they will work, hard to ensure that this moves forward. We're doing everything we can in our network to put that pressure to make sure there, it is time sensitive. The pandemic is now, workers are dying now. So we need this standard to pass as soon as possible. In terms of what possible resistance there is, we know that industry, chambers of commerce are not invested in this standard because it's employers who will be mandated to provide the programs in place. But we're hopeful that, again, with all our mobilizations on the ground and with the workers, that the urgency to save workers' lives will supersede the profit of a lot of these employers or industries.
Thanks, Jessica. We have a question from Fatima Hussein from Bloomberg BNA. Is this group or any group you're aware of calling to meet with OIRA, which I believe is the Office of something in regulatory affairs, or is there greater pressure to get the rule out the door as soon as possible? I believe the National Nurses Union has a statement out yesterday, already calling for a meeting. I don't know if Pascaline has anything to add on that. And I think some other groups are thinking about it, but I'm not sure what that schedule is yet. I don't know if Jessica, you have more to add there, or Jane, anything new on NNU's request to meet?
Yeah, so I just dropped a link to National Nurses United press release, our statement about the news that the ETS is moving forward. We are requesting a meeting as soon as possible to urge them to get the ETS out the door as soon as they can, and to make sure that the ETS, like Jessica said, includes all of the things that we know, all of the requirements that we know are necessary to protect nurses, other healthcare workers, and other frontline workers from COVID.
Thanks. I'd like to ask Maria de Rosario, since we saw Hugo by video, can you fill us in on what's the latest in Gainesville and how workers there are coping in the aftermath of that terrible tragedy?
Yes, thank you for having me. My name is Maria de Rosario. Once again, I'm the executive director for Georgia Familias Unidas, a collective aid organization based in Gainesville, Georgia, that was actually created to respond to the disparities in our immigrant Latinx community around COVID-19. So in the 3 months aftermath since the nitrogen tragedy that took the lives of 6 of our community members and impacted over 150 workers, we have been working closely to ensure that they are getting medical attention. Many folks still feel the physical aftermaths of the tragedy and of course the psychological impact. We're still working to ensure worker safety. The plant has, after shutting down for 3 weeks, asked everyone to go back, try to offer folks lower wages to go to another facility that pays minimum wage. That they also owned. They have hired a lot of new workers that actually don't even know about the nitrogen tragedy. There's a large barrier of language access to resources, the ability to even participate in some of the interviews with agencies. Gainesville, Georgia is known to have the highest per capita of undocumented immigrants in the country. For its immigrant population. And so you also have a lot of fear, extreme fear of ICE retaliation, and not just ICE retaliation, even death. If you interview these workers and work as closely as we have with them, we've worked with over 85 to provide rental assistance, to provide a stipend for their medical costs, to help pair them up with workers' comp attorneys, with labor attorneys, with Sur Legal and SPLC, 2 of the nonprofits who are helping with labor representation on a pro bono basis. We've also paired them up with immigration attorneys on a pro bono basis, but unfortunately the plant has not responded to the needs of folks. They still go back in and work with very, very hot oil in the fried or the partially cooked section of the plant. We've had multiple reports as of even 2 weeks ago that all of the production workers only knew about 1 exit. And so GAFU, as a employee rep, filed an imminent danger report, to which I know OSHA is working really hard to do some of these inspections. Unfortunately, we've also had a lot of the production workers are mothers. We've had 3 mothers who have suffered a miscarriage from pregnancies that they had before the nitrogen tragedy. A couple of them had their miscarriage right after. And so the loss of life and the impact on them is pretty steep. So those are just, highlights of some of the things, but happy to answer any specific questions that someone might have.
Joe from Labor Press and DC Report is asking if we know the percentage of workers being memorialized this year who died of COVID. We do not. There's not an overall tracking of who has died from COVID or not. In terms of the names I read in the beginning, I might be able to check, but sort of globally and nationwide, we just don't know. It's not being tracked. I think we're going to let our small group folks back in here, but if any other reporters have follow-ups or additional questions for our panelists, the floor is open.
I think Emily had one more question. And we have the breakout groups are coming back in 2.5 minutes. So we have a little more time here.
Emily, fire away.
I'll keep it quick. And apologies if this is outside the scope of this call, but I guess I'm just wondering, are there opportunities for OSHA to find companies who jeopardize the safety of workers in the prior administration? Or is this more about ensuring safety moving forward?
Well, I'm happy to answer that question, Jessica, with National COSH. So OSHA, unfortunately, OSHA under the former administration was completely missing in action. There was many missed opportunities to enforce the standards, even under the general duty class, to ensure protection for workers. We know something that we had reported on, and you'll see in our report, which we invite all the reporters here to take a look at, outlines also that there was a spike in OSHA complaints from workers for requesting OSHA inspectors to come to the work site and inspect, given the complete lack of disregard to safety in the midst of the pandemic. And unfortunately, there was less response, less actual actions, and less inspections happening in the former administration. So now with this shift in the new administration, we have new folks in OSHA. There's hope with the new release of this ETS that moving forward, we will have a more engaged OSHA. Again, this is a good sign already with this ETS moving forward, but most importantly, our responsibility on the ground is to ensure that OSHA is doing its job, is providing the enforcement. One quick reminder to folks here on the call as well is that OSHA, even pre-pandemic, has had very limited resources in terms of inspection. So we need to ensure that with the resources that are now available, that they do everything that they can to ensure quality enforcement is happening, that it's streamlined, and that they are taking action when workers are, submitting complaints and making these calls.
Thanks, Jessica. Do we have any other questions from
I've got one follow-up for Jessica, which
Go
is,
ahead.
do you anticipate asking OSHA to basically go back to the places where they were called under the Trump regime and didn't go?
That's a great question. And I think that is an expectation that we have, that we ensure that there is a streamlined process to follow up to these complaints. Also to note that we have made that our local COSH groups in some particular states, such as California, Virginia, Oregon, where there is state plans and have already also released local COVID standards, using those states as a model in terms of not just sort of implementation, but also enforcement. So it's a lot of moving pieces, but I think, again, we're hopeful that OSHA is doing its job, and we'll be doing, improving that in terms of the process as well.
Thank you, Mark. Thank you, Jessica. Do I have any other questions for our panelists who all did a tremendous job? I mean, the range of information folks were here to share, and the stories were just tremendously moving, and really, for me, a very important reminder of what Workers' Memorial Week is all about. This is just one of many events that are taking place across the country, across the world, but it was really terrific to have all of you with us and sharing your stories and your information, and putting that perspective of families and coworkers, and what the difference that organizing makes when people get together to improve conditions.
And I don't have a question, but I wanted to say to the journalists that are still on the line, Susie just added the report link on the chat. You probably got it from Roger earlier today too. But if you need like quick access, and then also that all our folks from the small groups are coming in. Thank you so much for coming back. We're hoping that you had good conversations with other people that are trying to save workers' lives. We have one more piece of agenda, which is an action that we wanted to do. And it's a very simple action. So if you're coming back You may have to mute yourself again. You may have to choose the interpretation again. So I'll give you a second to do that, but we also want you to start thinking about a name of a worker that you want to remember today, or it may also be a worker that's still with us that you think about to fight for. It can also be a group of workers that you're organizing. So it can be the Gainesville workers or poultry workers. And Susie, I'm gonna spotlight you right now because she has a perfect example. So what's gonna happen next is that, here you go. What's gonna happen next is that we are going to start a song, and this is already, the closing of our program today. We're very, very thankful that y'all are here with us, but we want to go and Marcy, if you can share your screen again, so you can,
sure.
There you go. And I have like Jessica and I have Susie that are already showing, but this is what we want you to do. So in the next one, thank you. Awesome. So we want you to think about someone that you're fighting for today. We want you to write their name on a piece of paper. It can be any piece of paper. It doesn't have to be anything fancy. And then we want you to choose one of these hashtags, either in English or Spanish. Work should not kill, hurt at work, or sick from work. And we want you to share it just like Jessica and Susie are doing it. We're gonna start some music to close us up. And we are going to also take some like screenshots for this sort of like virtual action that we wanted to take today. Is that clear? Let me see you all. Let me see if people are. Okay. So Jesse, you can start us off with some music. I'm gonna take some screenshots so we can post this as an action that we took together today. You can also, of course, take a picture, a selfie, and share this with social media later today. So we encourage you to do that as we start. Jesse, we're ready. And if you're, by the way, if you don't have one of those, one of the posters, if you can't make it, what we want you to do is to, or if you don't want to make it right now, what we want you to do is to stop your video so all the people that do have posters can move to the front, okay? So we'll do that. And Jesse, we can't hear your sound just yet, even though I see that you're sharing your sound, so.
Yeah, I'm waiting for you.
Oh, go for it. Sorry.
Here's a song we want to dedicate to all the workers who've been injured and killed on the job and their families. Imagine there's no heaven. It's easy if you try. No hell below us. Above us only sky. Imagine all the people living for today. Imagine there's no countries. It isn't hard to do. Nothing to kill or die for. And no religion too. Imagine all the people living life in peace. You may say that I'm a dreamer,
not the only one. I hope someday you'll join us, and the world will live as imagine no possessions. I wonder if you can. No need for greed or hunger. A brotherhood of man. Imagine all the people sharing all the world. You may say that I'm a dreamer.
Thank you, everyone.
I'm not the only
Muchas gracias. Thank you, everyone, for such a powerful action. I want to again take this opportunity to thank everyone that joined us here today. Took your time from work, from school, from your daily activities. Our wonderful speakers, our courageous speakers, and family members, coworkers that were here today. Thank you. I also want to give a big thank you to our national COSH team who made this possible. As you all know, I am just here as a spokesperson today, but this has been a tremendous team effort to bring this program to you today. Thank you to Peter, Marianella, Jesse, Marcy, Susie, Jesse, everyone here today. And to our wonderful network, I invite everyone again to go to our website, National COSH, follow us through social media. We will be posting today, retweet, repost, re-Facebook. I'm not sure what the language is there, but share the information, the infographics. We are also encouraging folks to visit our website for more local events that are happening this entire week. There's events that our local COSH groups are organizing, as well as many of our allies and other folks that are part of our Protecting Workers Alliance groups, hosting events across the country in both English and Spanish and other languages. This is a worldwide event. And again, we don't just want to memorialize the fallen workers, but be encouraged to take action and to not allow for more killings to happen in the workplace. So invite you again to visit our website and stay connected. Thanks everyone for such an amazing program today. Adios, gracias a todos. And thank you to our amazing interpreters who joined us and have always been very supportive. Thank you for your amazing work. To Rachel and Jamie, thank you. Bye everyone.
Thank you.
Thank you.
Muchas gracias.
Bye.
Be safe.
Bye, compas.
Get your shot if you haven't.
Thank you, everyone.
Thank you.
Yeah.